My first knee was about 14, 15 years ago. The other one had started giving me trouble, and so I had a couple of shots and it just wasn't getting any better, so I knew it was time to have it replaced. I went to Dr. Volatile, and I appreciated it because he really took the time to listen to me, to know what was going on and everything. And then he asked me if I would like to try the robotics. He told me he had done 160 times and that he'd been very successful with it. And he says it was less invasive. And I said, then I want to go for that.
With the Mako robot, you have a CT scan before the surgery. It's sent away, an engineer looks at it, and it comes back and it shows exactly what size implant fits properly, how many degrees this way, that way, how many millimeters to make the adjustments to where, the right amount of bone resection. And the cuts are so accurate, they're accurate to within 0.5 millimeter. That's actually enabled us to do more and more uncemented and press fit knees than we did before. A lot of my patients at 3 or 4 weeks are doing it as well as the patients used to do it 3 or 4 months.
I walked out of the hospital without a limp. With this surgery, he did the surgery at 11 o'clock. I came around at 11:30. They fed me something. At 12, I ate lunch. About 12:30, I walked out of the hospital. No one could believe that I did as well as I did with it. I went out to the clinic for therapy. They did an evaluation the first day and a few exercises. Then I went back for therapy 3 times. And he told me, he said, well, I just can't believe how well you're doing. The first time I went for the evaluation, I was already at the level that I needed to be. So I actually had 3 therapy sessions and that was it. And then I haven't had any trouble since then. I can walk anywhere I want to and I don't get tired or anything. I've walked 4 or 5 hours at a time and it doesn't bother me. So it's been very successful. I'm very happy with it.